Hello po and happy Saturday. Thanks for joining us. I'm Dr. Ana York Bondoc and our program is called Libreng Consulta. I'm an internist, an internal medicine specialist. I'm a pulmonologist, lung specialist. I run an ICU. I'm a former congresswoman and also a mom. So today we're going to talk about something na pinag-usapan ko na po dati, that is the flu vaccine. Kaya lang marami po talagang mga tanong, marami pong mga concerns. Meron din pong mga bagong nalaman. So I have it here. Can you see it? Eto po, ano? Flu vaccine. I have it here. Okay? The flu vaccine. So please follow us on YouTube and Facebook Live. We are trying to reach 1,000 followers on YouTube. So please like and subscribe po. And this is a live program. So we're happy to answer all your questions. Lagay niyo lang po sa baba. Okay? And we are going to pick up the questions that you placed on the poster kanina. All right? So let's go. Topic po is flu vaccine or ano po ang bakuna para sa flu. Okay, what's the flu vaccine? Ang flu vaccine po ay ang bakuna para sa flu. Okay? What is flu? Paano siya naiba sa COVID? Kasi nagkakaroon po ng confusion between the COVID vaccine and the flu vaccine. Okay? COVID vaccine, iyon po is against the novel corona-19 or COVID-19. So it's a coronavirus. Ang flu vaccine naman po, yun ang bakuna po against the influenza virus. So ibang virus po yun, okay? So talagang they are different, okay? They are not the same. They do not protect for each other. Iba po yung flu, iba po si COVID, okay? So the flu vaccine. The flu vaccine is a marami pong kinds of flu vaccine actually, so it can be a little confusing. Lalo na sa US, there are different vaccines for different ages, okay? But I'm just gonna tell you the major. The flu vaccine po is formulated yearly, and it's given po usually intramuscularly into the muscle po. And recommended for actually everyone, almost everybody po, dapat pong mabakunahan ng flu every year. And again, influenza A, there's influenza A, influenza B, influenza C, and influenza D. Pero ang pinaka-importante po talaga na ina-address po ng flu is influenza A and influenza B. These are viral illnesses. They are different from COVID. Okay? Iba. Next. Bakit siya yearly? Napakagandang tanong. Bakit po yung measles? You get one at 2 and then a booster at 7. Bakit po si rabies pag kinagat ng aso? Bakit? Okay, bakit yearly si flu? Okay, it has to do with the influenza A and B vaccines. Influenza A and B viruses. Okay? May tinatawag pong antigenic drift and antigenic shift. Okay, what does this mean? Every year, di ba naririnig nyo, the COVID virus is mutating. Well, the flu virus is also mutating every year. Ngayon, yung konting mutations lang po, no, change in the antigen, that is called the antigenic drift. Okay? Yung antigenic shift, yung major change po sa antigen. So every year, nagkakaroon po ng drift ang flu. Okay? Every year, the flu virus changes a little. Okay? And the world scientists po, based on what happened the year before at ano po yung predictions nila, they will adjust po the vaccine to adjust po for the mutation. At ito po yung reason kung bakit po yearly. Kasi yung laman po nung last year, hindi po yun yung laman ng this year. At iniiba-iba po nila ng konti to account for mutations in the flu virus. That's antigenic drift. Ngayon, pag magkaroon ng antigenic shift, talagang may iba ho siya. This is what usually causes flu pandemics. And it has happened po in 1918. There has been pandemics po, not as big, over the last few years. So, nagkakaroon din ho ng flu pandemics kasi biglang naiiba po yung variant po, no? The mutation, it's called an antigenic shift. So, yearly, we have to take the flu vaccine. Okay? Next po. Who should get the flu vaccine? Almost everybody po, ano, all those infants above 6 months, and everyone po as they get older. there is a special, ano po, there is a special precaution po, no? Um, especially for the elderly kasi pag magka-flu sila, baka po maging mas serious. And there's also a recommendation for pregnant persons kasi po, magka-flu sila, syempre buntis sila, that's not good. Number three, also for those who are immunocompromised, those getting transplant patients, yung mga nagkakapapakimo po, and those who are ano po, in charge of patients. Kasi po kung ma-flu ka, then mahawa yung pasyente mo, kawawa ka naman. So almost everyone po should get the flu. Who should not get the flu? Yung mga allergic po sa flu vaccine. How is it different? Yes, that's a good question. Ano po? Iba-iba po talaga. It's completely different. It is completely different because it addresses completely different illnesses po, no? So the COVID vaccine is for the COVID virus and the flu vaccine is for the flu virus or the influenza virus A and B. Okay, next. Let's pick up po questions. So yun po, no? Summary ko na lang for the flu vaccine. The flu vaccine is usually an inactivated vaccine po. It is usually quadrivalent for two influenza A, two influenza B strains po ang ipinapasok po nila, and they choose different strains yearly based on what they think will be prevalent for that year. It is mostly given po and highly recommended for children, elderly, those immunocompromised, and those working po in healthcare facilities. Though everyone can have the flu vaccine. The flu vaccine will prevent po kung magka-flu pa, first of all, it will prevent you from getting the flu. Secondly, kung magka-flu po kayo, it will make the days of your flu shorter. So magiging mas mild po yung illness nyo once you get the flu vaccine.
Okay, question number 1. Doktora, pwede ba bakunahan ang kids ng flu vaccine?
Yes, they should be. Benji po was vaccinated the same time as me. All those kids 6 months po and above, they really should be vaccinated with flu yearly. Kasi po, well, they go to school na nagkakahawaan din in school. And again, because their immune system is not so mature, pag nagkasakit po sila ng flu, it can be potentially serious.
From Mr. Jimmy Soriaga. Good afternoon, Dr. Anna. Pwede na po ba ako magpa-flu vaccine? 3 months na po ako fully vaccinated ng COVID vaccine.
Yes, you can. Actually, that's a very common question po. No? What is the timing between the flu vaccine and the COVID vaccine? Actually, wala naman hong pagbabawal na dapat magkahiwalay. But as doctors, we normally tell people, wag niyo pong ipagsabay. Why? Kasi po, baka magsabay-sabay yung mga side effects. May side effects din po yung flu vaccine. O, sige, puntahan na natin si side effects. Most of them, bibigat po yung kamay nyo. Sometimes, pwede po kayong manghina or you feel like you have a flu-like illness. That is your immune system working. So, again, hindi naman po mga grabe po yung mga side effects of the flu vaccine. Very rare po. Similar to COVID, very rare. Pero again, ayaw po natin ipagbangga sila. We don't want them to go together. Kasi what if you have side effects from both, diba? So wag na lang. Either flu vaccine first and then COVID, or COVID first and then flu. Please, there is no rush, okay? Hindi ho kailangan on the same day. So, ano po yung pagitan? 2 weeks? Most people say 7 days to 2 weeks. Okay na po yun.
Next question po is, Dr. is there side effects to flu vaccine?
Meron po, no? Most of it is given intramuscularly. So, pwede pong bumigat yung inyong kamay. Again, pwedeng medyo maging tender, mamula ng konti. Put cold compress, wag pong magbuhat on that arm. And then, yung sa fever po, slight to maybe manghina, you just stay in bed. By 12 hours, 6 to 8 hours, wala na po yun. I've had the flu vaccine numerous times. Okay naman po.
From Ms. Cathy Rodriguez. Doc, how long do flu antibodies last?
Ma'am Cathy, nobody can answer that question kasi we do not measure antibodies po of the flu. Hindi po ginagawa yun talaga. The reason that we change it yearly is, as I told you, the flu virus, kung ano po yung mga usong strain, changes yearly. Whether the COVID will be like this po, we do not know as of today. Okay?
Doktora, what's the death rate for flu? Is it true na parang flu lang COVID?
The flu, how do people die from the flu? Ako, I've always been taught this. People don't die from the flu because of the flu. Bumababa po yung immunity nila, and then a bacterial infection sets in, and then they die po of the bacterial infection. That is really very commonly taught sa amin po sa flu. Okay? It's not necessarily the flu, but yung debilitation po na mangyayari, lalo na kung may edad po, you will die of a bacterial infection. Usually hospital-acquired pneumonia. Okay? That this can also happen in COVID. But again, yung death rate po ng flu, mababa lang po talaga. It's estimated to be even 0.01 eh. Wala pa po sa 1%. Ang death rate po ng COVID for everyone is 1%. But for elderly, it's 10 to 15%. So, matindi po talaga ang COVID as you get older. So, but again, we don't want people to die of the flu. One very good question na hindi natanong. When someone, bakit bumaba yung flu last year? Ito ang sagot ko po doon. Because of the mask po that we are wearing all the time, yung we are not passing the COVID virus, and we are not passing the flu virus kasi yung flu po is also a respiratory virus. Okay?
Doktora, is it true that flu vaccine protects against COVID?
Magandang tanong ito. There have been a few studies in the US that have shown na if you get the flu vaccine first and then the COVID vaccine after, parang pag nagka-COVID ka, mas mild. But again, hindi pa siya masyadong, hindi pa few studies pa lang. But if you can get the flu vaccine before you get the COVID vaccine, wala naman pong masama. Okay? Kasi you may reap some benefit. Ako po, I got the COVID vaccine first. And then I got the flu vaccine next. Wala naman din pong masama doon. But there are a few studies coming out now na if you get flu vaccine and then COVID vaccine, and then let's say you got sick, it's protective daw. So do you want to see the flu vaccine? I'll show you dito po. Sige, Miss Jessica, go.
From Miss Jessica Tupas. Dr. Anna, is it okay for my kids to receive the flu vaccine if nag-positive po sa allergy test for egg? Nagka-influenza B infection din sila this year, 2019.
Ma'am Jessica, no? Before I was taught po na if you have an egg allergy, you should not get the influenza vaccine. But there are newer vaccines now that are okay now for those with egg allergy. In fact, sabi nila, it is extremely rare. My best advice to you, patingin niyo po sa pediatrician po yung anak niyo. Kasi I don't know the details of the egg allergy. Okay? And then, pag-usapan niyo po with the pediatrician. Kung kailangan po, you can also consult an allergologist. Pero rare na daw po talaga ang egg allergy reactions to the influenza vaccine, especially the more modern ones. Let's unbox po, no? Ito po, Fluarix tetra. Let me read it. Fluarix tetra, quadrivalent seasonal influenza vaccine, Southern Hemisphere 2021. Dito po. Ito na. So I'm showing you this. Ayan po. Miss Kat, can you see? Ayan po, no? So, let's unbox. Dito po, no? Ito po yung sa tatay nila, hindi ko pa nabibigay eh. Opo. Ayan. So, ito po yung instructions. Here. Ayan po. And, naka-ref po ito. Ayan, no? Dito po, no? Here. It's already coming po with its own, may needle na siya. Okay, wag po nating bubuksan kay Dr. J po ito, no? But this is what it looks like, no? Ito po yung box, quadrivalent Fluarix flu vaccine po. Okay? So, later, babakunahan ko po si Dr. J. Again, Dr. J already got the COVID vaccine. Astra po si Dr. J. And bibigyan po natin ng flu vaccine si Dr. J later on. If you have a flu vaccine, you can keep it po in the ref and then bakunahan na lang po yung tao later. Intramuscular po.
Okay. From Dion Megan Laman. Doktora, pwede lang ba magpa-flu vaccine and pneumonia vaccine kahit may COVID vaccine?
Yes, pwede po. Um, Flu vaccine, any age. Pneumonia vaccine, usually po for the elderly, age, sabi po nila 55 and above eh, or even 60 and above pwede po, no? And the immunocompromised. Again, please wag niyo ipagsabay-sabay. Please put gaps. Not because it's not allowed, but because we don't want the side effects to get together.
From Miss Cecil Siwa Gonzalez. Good afternoon, Doc. Last year po, nabakunahan na po kami ng flu vaccine. At tanong ko lang, Doc, ilang months or weeks after COVID vaccine need naming mag-take uli? Thanks and God bless.
Ma'am, normally nakalagay, ako personally advise people 2 weeks to a month, okay? Kasi there's really naman no rush, okay? Nakalagay po dun sa, nabasa ko from CDC, 7 days. Pa ako naman po, wala naman po talagang rush na kailangan. Pwede na lang ho kung nabakunahan ka ng flu and then biglang sinawag yung pangalan mo sa COVID, ano? I would suggest wait na lang po 7 days sa mga ganon. Pero if you got the COVID and then you're waiting for the flu, you can take 2 weeks, no rush. Ang ano lang po, siguro ang rush lang kung nagpa-flu ka, then biglang tinext ka ng barangay, siguro po magpalugit na lang po kayo ng mga 7 days. Okay?
From Miss Josunga. Gaano po katotoo na hindi ka magkakaroon ng malalang COVID kung meron ka anti-pneumonia vaccine and flu vaccine?
Ma'am, the evidence is not for the anti-pneumonia vaccine. The evidence is for the flu vaccine. There are beginning studies na it will become milder. But again, marami pa pong evolving in that field. Hindi pa po 100%. But there are some preliminary studies that have shown that having the flu vaccine before the COVID vaccine can give you, it can have a protective effect. Pero ito yung sinasabi ko po sa mga tao. Na people ask me, Doctor, why should I have a flu vaccine? Ang dami ko ng vaccine. Ganito yon, okay? Meron talaga, nung wala pang COVID, okay, nung wala pang COVID, meron talagang na-ospital for flu. Okay? Meron talaga. Okay? At meron talaga yung nagkaka-flu. Maraming nagkaka-flu. Eh, ang tanong ko sa iyo, gusto mo bang mapunta sa ER, lalo na ngayon, kasagsagan ng surge, tapos because you have the flu, eh di baka ma-COVID ka pa doon sa ER na yun kahit, do you get my point? So anything that can stop you from getting sick or going to the ER, eh dapat pong i-pursue. Kasi if you get the flu and you get yourself to the ER, at ngayon pa namang surge, talagang hindi ho maganda yung sitwasyon doon. Huwag nyo na hong ipagsaksakan pa yung katawan nyo doon unless absolutely necessary. Okay? So, if you can avoid getting the flu, you should. Kasi right now po, anyone na inubo, anyone na nanghina katawan, anyone na tumulo po yung ilong, talagang isolation at huwag ka nang pumasok ng trabaho. So, if you can protect yourself from the flu, you should. Kasi po, baka pwede kayong magpagkamala ng COVID, so you cannot go to work, ano? Number 2, baka mapaswab pa kayo ng gastusin. And number 3, the worst is, if you get the serious kind of flu at meron talaga, no? Mapunta pa kayo ng ER and you don't want to join the situation po dun sa ER. So yun po yung main reasons for getting the flu. Aside from it can be protective, but the most important is you don't want to get sick during this time of COVID that would cause you to go to the ER. Okay?
From Miss Zarina Claire. Hi, Doc. What is the sufficient window between a flu vaccine and COVID vaccine?
Ma'am, I researched it that CDC is saying 7 days. Ako personally, I would say 2 weeks. Um, excuse me. Kung na-flu kayo, then tinawag kayo sa COVID, just let a few days pass, okay? Kung na-COVID vaccine naman po kayo, there is no rush to have a flu vaccine. You can take your time.
From Mr. Jimmy Soriaga. Ilang days po, Dr. Ana, bago mag-effect ang flu vaccine
2 weeks,
after
sir.
ma-injection na?
Sir, usually 2 weeks din. Same as the COVID po. Pasensya na.
From Miss M. Jane Parane Infante. Hi Doc, how much po ang flu vaccine?
Yan ang maganda. Kasi I bought mine, I think for one, nakalagay po sa internet, eh, you can purchase. There are lots of people purchasing. Try selling. Buy na lang po from a, nagva-vary po eh. May nagsasabi pong, I cannot remember po how much I paid eh. Kasi I paid for it from the, from the, from the pediatrician. Pero, get from a recognized from a recognized clinic kasi marami yung nagbebenta ngayon na you know naman what I mean. Okay, I don't wanna say it na lang po.
From Miss
Ay,
Annie Dionisio.
sorry.
Sige
Sorry. You can possibly get it free po sa government. Meron pong ganun.
Yes po. From Miss Annie Dionisio. Good PM po. Nagpa-flu vaccine ako last July 2020. May effect pa din po ba ito this month, August 2021? Thanks po.
Pwede naman po because you still develop antibodies po eh. And it is possible po, no? It is possible. I wouldn't say wala na pong protection, ano? And sabi nga po nila that getting it every year, parang nakaka-build up ka rin ng protection eh. So, pero every year po, it is recommended kasi again, nag-iiba po yung flu yearly. Yun po yung problema po doon na aasahan po natin yung lumang bakuna.
From Miss Marilu Isip Lakap. Good afternoon po, Doktora. Kailan po pwedeng magpa-flu vaccine after magpa-COVID vaccine?
Ma'am, normally, there is no rush to have a flu vaccine after the COVID vaccine. You can take your time. I would say 2 weeks to a month is more than okay.
From
Ang
Miss
ano po,
Villet.
sorry. Ang ano lang talaga, Miss Kat, halimbawa, ang tagal-tagal mo nang naghihintay sa LGU, wala tumatawag sa'yo. So, hinaya ka ng doktor mo, oy, pabakuna ka na ng flu habang naghihintay ka. So, nagpabakuna ka ng flu, no? And then the next day, na-text ka ni LGU. So, nagpapanik ka ngayon. Ang advice ko sa'yo sa mga ganong sitwasyon is, i-delay mo na lang muna talaga si LGU, kausapin mo na lang. And wait for 7 to 10 days, okay? Pero for example, nagpa-COVID vaccine ka today. Tapos may nagsasabi sa'yo, ipa-flu vaccine ka rin. There is no rush. You can wait for 2 weeks. You can wait for 1 month. Then pa-flu vaccine ka. Hindi naman sa it's not good, pero we don't want to mix the side effects. Okay? So yun lang, there's only one emergency eh. Kung nagpa-flu ka, tapos biglang tinawag ka na LGU. Pero yung nagpa-COVID ka, and then somebody said you should get the flu, you can wait. Wala naman pong ano yun. Ang importante po, and this is very important, what is an emergency po is not the flu vaccine. What is an emergency is, you got COVID today and then a rabid dog bit you, nag-tricycle ka, umuwi ka, kinagat ka ng asong ulol. Today, kailangan mong bakunahan ng rabies na gets kasi mamamatay ka ng rabies. But flu, you can take your time. Also, if you got a serious wound, you need to get a tetanus vaccine po. Kahit na COVID vaccine, for example, na COVID ka ngayon, going home, naputukan ka ng firecracker, pa-tetanus shot ka, please.
Okay, from Miss Willette Sunga Perez. Hello po, Madam Ana York Bondoc. Our teachers at San Vicente San Francisco High School, Macabebe, already had their flu shots, courtesy of the school's MOOE funds.
I see Miss Willett is the head teacher and principal po, a high school principal and a very capable lady. Ma'am Willett, I am very glad to know na protected na po ang teachers. Thank you so much.
Yes. From Miss Remy Reyes, Doctora, is it okay or safe to have flu and pneumonia vaccine at the same day?
Pwede po, no? But ako, I do not like to do that. It's just like ayoko magsabay eh. Pwede naman hong bumalik. Mga excited magpabakuna, that's good. I'd like to put it is possible, but I don't like to do it. To Ma'am Willet and the teachers, I just wanted to say also, I am the speaker po of the LaSalle Green Hills Parents Association. August 27 po, it's called Living with COVID. Everything about vaccines, parents, kids, and how to live your life with meaning and purpose in the middle of the pandemic. So willing po ako dito to do this for public schools, just call me. I have done a number of talks for public schools. And ngayon pong nagbubukas ang vaccination, it might be something good to review po talaga yung mga issues surrounding vaccination.
From Miss Beryl Inda. Doktora, okay lang po ba magpa-vaccine ng anti-pneumonia ang 11 years old?
Ma'am, normally po, no, I'm an adult doctor. I am not a pediatrician and I cannot pretend to be. Ma'am, normally sa amin, anti-pneumonia po is 65 years and above. I would suggest po you consult po. And those who are having cancer, chemotherapy, dialysis, severe diabetes, ganun po, no? I would suggest po that you consult po yung pediatrician nyo. Ay, by the way, on Monday, 9:30 a.m., we are talking about kids and COVID with a national expert, Dr. Lulu Bravo. Dr. Lulu is a full professor of the UP College of Medicine, a Department of Pediatrics. She is retired. She is the national chairman of the AEFI, that's Adverse Effects Following Immunization. She is an immunology expert, a vaccinology expert, and she will be talking on children and the pandemic. How risky is it for your kids? Um, Anong effect ng mga kids na nahawa sa magulang? How can we protect the kids? Can we vaccinate kids? Ano po ang nangyayari sa mga batang may COVID? May namatay na hubang bata sa Pilipinas with COVID? What is the situation po abroad? Pag-uusapan po natin lahat ito on Monday, 9:30 in the morning. Dr. Lulu Bravo is one of the best pediatricians, one of the best vaccinologists, batikang researcher. She's my idol. Dr. Lulu Bravo. Monday, 9:30 a.m. Kids and COVID.
From Miss Teresa M. Tungol. Doc, good afternoon. Na-vaccine na po kami ng Sinovac. Okay na po ba magpa-flu vaccine?
Yes, magpalugit lang po ng mga 2 weeks and then get your flu vaccine. I got vaccinated with Sinovac in May. I got my flu vaccine in June. June po. Sorry, April po yung Sinovac ko, June po si flu. Si Dr. J naman po, last dose of Astra was June. He's gonna get his flu vaccine probably tonight.
From Miss Cathy Mendoza Bungay. Doktora, need pa po bang magpa-flu vaccine kahit may anti-pneumonia at COVID vaccine na? Thanks po.
Ma'am Cathy, the anti-pneumonia is usually for those 65 years and above. And that's a different vaccine from COVID and a different vaccine from flu. So my answer to you is yes, kailangan pa rin po. But again, the anti-pneumonia only every 5 years yan or even nga 10 years yung iba. Flu every year. COVID, hindi pa natin alam.
COVID topic po yung next. From Mr. Nelson Ercia Abesamis, should a COVID survivor need a COVID vaccine?
Yes, the answer po is yes. Because po, the antibodies that we get from COVID, from the natural antibodies that we get from a COVID infection, ang sabi po talaga ng mga dalubhasa at scientifico, mas matagal po and mas stable po yung antibodies that we get from a vaccine. So, dati po, they used to say 90 days after you become positive. Pero ngayon, as soon as you are okay, wala na pong symptoms, you can get a COVID vaccine. And you should get a COVID vaccine if you are called by the LGU po. Okay? Meron pa. Okay.
Yes po, last question na po. From Miss Meng Canlas. Doc, pag nag-positive ka, ilang araw bago magpa-vaccine sa COVID?
Okay, I got it. If you became positive and recovered from your COVID positivity,
Yes.
ganun ba? Yun ang pagka-identity ko.
Opo.
Ma'am, dati po, di ba, they used to say 90 days. Ngayon po, as long as you're okay, fully recovered, no more symptoms, feeling good, pabakuna na raw po. Kasi talagang laganap po si Delta, baka magsakit pa kayo ulit.
That's all that we have po.
Okay, very good. Last message about the flu vaccine. The flu given po every year because the flu changes every year. Yes, you should get your flu vaccine despite having a COVID vaccine dahil iba po yung sakit na yon. May nagsasabi po na having a flu vaccine before the COVID vaccine is protective. But more importantly, nagpapabakuna po tayo kasi ayaw po nating magkaroon ng flu, magkakaroon po tayo ng panghihina, ubo, tumutulong sipon, we have to stay in bed, possible like that. Lahat po yun sintomas ng COVID eh. So, kung pwedeng wag na humagka-flu, baka mapunta pa kayo sa ER ngayon. And talagang ayaw po natin pumunta ng ER ngayon, nakakatakot. So, pabakuna na po kayo ng flu so that you don't get the flu. And later on, pabakuna rin po kayo ng COVID so you don't get COVID. Okay? So, sa inyong po lahat, flu vaccine is very important. Maraming salamat po and magandang hapon. Thank you so much.